In the United States, our cities and towns are filled with the sounds of hustle and bustle. Walk outside, you hear traffic, maybe a little music, maybe children playing, maybe not so much of that last one these days. Why? Because studies are showing that children's ability to move freely and safely in urban settings is on a steady decline. Traffic, inadequate infrastructure, socioeconomic disparities, all of those have placed significant barriers on the mobility of children. I, like a lot of people, grew up hopping on my bicycle, riding hither and yon through the various towns I lived in, walking down to the neighbors to play, and actually just playing in vacant lots and things like that. Those days aren't necessarily with us anymore. So today we're talking about how to improve children's safety and mobility in urban environments. I'm Ed Emmett, a fellow at Rice University's Baker Institute for Public Policy in Houston, Texas, and this is Baker Briefing. For today's discussion, I'm pleased to welcome two experts from our Center for Health and Biosciences. Zoabe Hafeez is a non-resident fellow, and Sandra McKay is our Huffington Fellow in Child Health Policy. Zoabe, Sandy, thank you for being here. So let's just jump right in. Zoabe, in a recent article, you wrote that in 1969, close to 50% of young people walked or biked to school, and now this number is just over 10%. Two questions. First, 50% of people, of young people, where? Are we talking just United States, or are we talking Houston, or whatever? And then tell us more about the decline, and is this a trend we're seeing around the world or just locally?
Your first question is just the United States, but to your second question, at least in the Anglosphere, Canada, Australia, and England, we're seeing the same phenomenon. For example, in Australia, between 1971 and 2013, the last time I saw the data for them, they had kids 4 to 9 going from 70% to about 30% walking to school. So the phenomenon is certainly within the English-speaking first world and is likely global and a lot, maybe not ubiquitous, but in a lot of places that maybe we aren't even measuring.
We'll get back to the whys and wherefores, why that's occurring in a minute. But Sandy, why does it matter whether children are out walking or biking to school, and how important is that physical activity for a child's development?
Well, just like for adults, physical activity for children is super important for their health. I grew up as a kid kind of like you, Ed, where my mom sent us out on our bikes and said, come back when it's dark, and we just rode around and enjoyed being a kid, getting into trouble, drinking out of the water hoses, random neighbor. But physical activity does good things. It decreases sedentarism. It decreases that risk for obesity. We're in the middle of an obesity epidemic in this country, right? It does nice things for your body, builds those strong bones, good muscles, good joints. It decreases your risk for things like heart disease. It has a huge impact on mental health, especially for children, and we're in the middle of a mental health crisis among our children and adolescents in this country. But other things that it does for kids that we don't necessarily think of is things like their cognitive development too. It improves concentration, memory, problem solving, and these translate to things like their academic performance, which we want to see because kids spend the majority of their time in school. We want them to learn well, and physical activity can help with that. And it also improves their social emotional development. When you think about kids when they're running around on their bikes and playing, especially in like a free play environment, they're learning how to be social in groups, work together in groups, do things like cooperation, teamwork. They're developing those leadership skills and developing a little sense of autonomy and their sense of self, and learning how to play and work well with others. I think of it as like the play well in the sandbox kind of skill together. And all of those things collectively just kind of help them grow and be a good adult.
I don't want to go into my past, but it seems to me that when you're off on your own or off with your friends, you have to make decisions on your own. Try to stay out of trouble, but if you get in trouble, try and figure out how to get out of it again.
I was going to say, sometimes you have to decide, is this a good choice or a bad choice? And if it's not a great choice, now you have to problem solve on how to get out of that bad choice that I made too. And that's an important skill too.
So the statistics show that children aren't as active. They're not able to get out and about as much. So Zoabe, let me go back to you. Why is that? I mean, I've grown up in a rural environment, in a middle-sized town, and in a big city. And since we're in the big city of Houston, You get into traffic concerns, stranger danger. How do those things impact a child's ability to move freely? And why is it so different today than it was, say, in 1969?
I think you hit the two major themes. When you ask parents, the major perceptions are, I'm afraid my baby's going to get hit by a motor vehicle driver, and I'm afraid my baby will be abducted, or I can't trust the people out in the community. Now, it's been well reported that pedestrian injuries have been going up recently. And there's a Montreal study where they did show that children walking to school were 4 to 5 times more likely to be injured, and children biking to school were over 20 times more likely to be injured. And most of those injuries are minor, but still, the idea of getting injured is not something any parent really enjoys. Then there's the idea of stranger danger. My opinion is that's not very evidence-based. So, for example, there's over 70 million children in America. Something like 100 to 150 kids get abducted by a stranger. So what we're talking about when we're talking about the pure scale of the reality versus the perception of stranger danger, from an evidence standpoint, it's not quite there. And why we believe it is probably a little bit more multifactorial. I think at least part of it might be the decrease in another metric that we've seen over time that's more in the sociology zone, but is this idea that we don't know our neighbors as well as we used to a generation ago, 2 generations ago. And when you go back to the 1960s, like you mentioned, the number of people who knew a large number of people on their block was much higher than it is today, where many people can report knowing none of their neighbors, especially in Houston, in a major city.
Yeah, I certainly don't want to get us off the subject, but the only fear I had of my neighbors was they might tell my parents that I was doing something wrong, but I never was particularly in fear of being abducted or anything. But neighborhoods are different. And even in a big city like Houston, some neighborhoods, I guess the school is close enough to walk, others it's not. Some have sidewalks that are in good repair, some don't. If you get out into the suburbs, typically are pretty good for walking, but that in between, there are places where you don't have sidewalks. You'd have ditches alongside the road and all that. So how do the differences in neighborhood impact this, and what are some of the specific demographic or socioeconomic factors that influence the access to safe transportation?
Yeah, and I know who I'm talking to, so I know that you know that this is one of the most diverse places anywhere in the country. Not just the city, the county, but even the counties surrounding Houston. And to your point, we just released a study last month, I think, where we looked at where in the city of Houston, children who were walking and biking were getting hit by motor vehicle drivers at an unusually high rate, like a statistically significant hotspots. And we found a collection down the I-69 corridor, but then we also found one in Sunnyside. And this speaks to your question because Sunnyside did not fit the built environment that we expected a hotspot to be in. So all the hotspots down that 69 corridor were on specific intersections where you could say, okay, around them it's relatively cold, and then boom, right when you're on this very busy intersection, a lot of kids are getting injured. Sunnyside, it was a square mile right in Sunnyside, if you know where, I don't want to say the school names because I forgot them off the top of my head, but some of these kids were getting injured on very fast-moving thoroughfares. Some were getting injured on a really narrow neighborhood street that's just got houses on it and really shouldn't have had much traffic. Some were getting injured on an intersection. Some were getting injured on a mid-block crossing. And the truth is, I don't quite know what to think. But the more we've been talking about this particular square mile, one thing keeps coming back is the solution that Sunnyside may need to decrease their child pedestrian and bicyclist injuries may be different from what Gulfton needs, which was another hotspot, and maybe different from what A-Leaf needs, which is another hotspot.
So he's laid out the problem. Sandy, what are the answers? What are some of the policies that can be implemented or areas for improvement that could ensure children's mobility and safety?
So there's a lot of different areas for opportunity, and I think some of the things that we can look at are looking for active transportation and make sure, do we have standards around those intersections and pathways to schools to make sure that we are looking at similar and appropriate things? So do we have ways to promote that for children and standardizing that across the board? So I tend to focus around schools because that's where the children are. It's where they spend most of their youth is around those schools. So looking at those communities around schools to say kids are going to go back and forth to school, can that be a safe safe way there. But then also while they're at school, how can we promote physical activity while they're even in schools? Where are the policies that exist around promoting physical activity within the school day itself? We do a lot of sitting in school. Not a lot of schools actually mandate or require physical activity education classes. So certainly when you look at the data around what are the policies around PE classes that are required from a national standpoint, for high school, 2% of schools nationally require a daily all grades every year high school PE class. So, and that's for the high school level. When you look at schools that require safe and adequate PE equipment or facilities, it's 2% for elementary, 4% for middle school, 4% for high schools. And this is data that came out from the 2011-12 school years. And even when we do things like requiring PE teachers to have certain qualifications for instruction, 25% for elementaries, 28% for middle school, 25% for high schools, that we require certain qualifications for PE teachers as well. So from a policy perspective, we can shore up what we're doing within the educational system to make it part of the child's day. Right? And when we do little adjustments like that to say, hey, let's get kids active, even little things like elementary school has daily recess. We cut that off at elementary. We're taking away opportunities throughout the day for children to be active, incentivizing and creating opportunities for safe and active transportation, because that adds minutes to a kid's day, every day where they're being active and we're promoting that physical activity. So if we can implement policies that will increase those daily minutes, because we have to, one, ensure that kids have those opportunities within the school day, but then two, we can't always guarantee that when a child's at home, they're going to be in an environment that is safe for them to be able to get that physical activity at home. So we need to promote that within the school environment as well.
I wonder how many people in the general public would be shocked at how little physical education is required in schools. Because we grew up in an era, not only did you have PE class, you had to shower real quick. But those days, I know from my own children and grandchildren, those days seem to be gone. So if they're not going to get the exercise in school, we won't take on education policy today. Zoabe, what do we build so that they're encouraged to walk or bike to school? And I'm going to throw a little bit of a curve in here, because now bike and pedestrian paths are mandated anytime you accept federal dollars for most projects. But I'll say this, you don't have to agree with it. I look at the bike paths that are being built in Houston, and they look like they're being built for adults to ride for recreational purposes on weekends, rather than saying, okay, here's a school, here's a neighborhood, why don't we connect it with a bike path? That to me would make more sense, but you're the expert, not me.
So the first thing I'll say is I do think that there has been a general theme in transportation policy. My wife keeps reminding me, I'm going to be 39 soon. Over the last, say, decade or so where I've been following it, I do always get the feeling that we generally think of children as an afterthought when we're thinking about how we're going to rebuild a road. How are we going to rebuild a particular stretch, or how are we going to come up with regional transportation plans? And obviously, I'm a pediatrician. I wish we'd think about kids more. So effectively, the point I think you're making is, look, how do we get kids who live nearby a school to that school? I'll take it one step further. Once they come home from school, how can they then access their place of worship, their YMCA, their community center, whatever it is? The dream would be, without mom or dad, I'll see you at dinner time. How do you build a neighborhood that facilitates that? To me, I think you spoke to this a little bit earlier, a lot of Houston area neighborhoods aren't actually that far off. And when you go to a particular neighborhood and you ask them what they need, oftentimes it's one intersection or one stretch of fast-moving road that really just needs to be addressed. And then you just unlock a whole other part of the neighborhood for that child. Or it's one particular school that's just oriented in the wrong way, meaning the front entrance is on the fast-moving road, but there are 3 other sides of the school that kids who are not taking a motor vehicle to get to school can access, because the back side of the school faces the neighborhood. And just making that entrance a little bit more easy for a child to go from the street into the school. Oftentimes little things like that don't need a gigantic national infrastructure plan or need to be a part of that can really make a difference for that particular neighborhood.
So to either one of you, I've lived in one of the Houston suburbs that had these magnificent green belts and trails, and my children, who are all adult now, still talk about the days when they just went riding their bikes and roaming on those. Not even just the higher end subdivisions that are built in the suburbs, all seem to have that in place. How do we get that kind of thing in place in the inner city? Either one of you can take that one on.
I think it's already starting to happen, Man, it just depends on the neighborhood. I feel like some of the more affluent neighborhoods in the central neighborhoods are already starting to see some of the effects of decades of investment on off-street trails. Buffalo Bayou is famous now. I think people nationally know about it, and for good reason. Northeast Houston, so outside of the loop, inside of the Beltway, there is, if you guys know where LBJ Hospital is, kind of going behind there towards the northeast, they've done a great job of trying to build up trails in those neighborhoods too, and also in the Third Ward, the MKT trail kind of goes down there. And at least in the Northeast Houston portion, there are issues with people getting hurt. People don't feel like those trails are safe. So I think there's two elements here. One is, how do you take the opportunities for building infrastructure? We have this beautiful gift of the bayous that people who've come before us have put the time in to invest in and connect and put trails along. But then the question is, once those are in, first of all, are we investing in the right neighborhoods, investing in neighborhoods that need the investment? And secondarily, how are we addressing the needs to make sure that those particular trails get connected, not just in a meaningful way, but also in a safe way, to the places that kids actually need to go to? Specifically, are these trails getting close to schools? And then is that final area from the trail to the school also safe for the child to go on?
And even going beyond trails, making sure that there are safe parks, safe playgrounds, equipment that is age appropriate and safe and secure, so that kids can walk up to a playground that they can access and it's age appropriate. Like mom can say, go up to the park, have fun, come on back, just go and have that free imaginative play.
Again, it was a long time ago, but I remember being really young, and sometimes going 2 blocks was a great adventure, depending on your age. And then as you got older, you could wander farther and farther away. But we have some neighborhoods that have sidewalks, but they're not in good repair. Can't ride a bike on them, for example. And that gets into an interesting situation, because with all the emphasis on bicyclists sharing the road, children you don't want them sharing the road on their bicycle. They're going to be on a sidewalk. And so how do we get a focus back on that kind of infrastructure? It becomes a lack of funds. Where do you put the funds?
I mean, in my neighborhood specifically, kids bike on the street because the motor vehicle drivers are going so slow. It's a neighborhood. I think the question really speaks to when you're getting to the more fast-moving roads. And the answer is, I don't know. But one thing that seems to be working in the Houston area are these wide shared use paths. And I'm not speaking just about bike lanes, but I'm just speaking about maybe what you could just call a real wide sidewalk in places where the opportunity presents itself. Have y'all ever been in a situation where you are walking down a neighborhood or on vacation or in Houston, wherever, and you have kids that are 4 or 5 years old that kind of can navigate the environment a little bit, but nothing complex. And you just let them walk up and down, you let them go forward, and then other situations they're tight on your hand. My theory is, and I hope I'm answering your question, my theory is that there are ways that we can build our sidewalks and our shared use paths in these particular streets when the opportunity presents itself, to effectively give that mom or dad the signal to say, your kid can walk 5 feet in front of you and then kind of run back and then walk forward and walk back, as opposed to, boy, if he's more than 6 inches from you, you're going to feel really unsafe. And I think that might be one of the keys in creating an environment where kids are feeling comfortable in their own neighborhoods, even on the main roads of their neighborhoods. I don't know if that answered your question.
Yeah, it kind of leads into what might be the final question. We live in an era where the technology is much, much greater than it was, certainly when I was growing up. How does that technology come into play? How can it be used to help? People bemoan the fact that too many kids are sitting at a screen all day, but it's good for other things. But how can we use technology to help more exercise?
I recall with my children, I'm always like, get off the computer, go outside, get on your bikes, go somewhere. And they're like, where? I'm like, I don't care, go outside. We can be creative with apps too. And I think when Pokemon Go came out, I think all of us pediatricians were like, what an amazing thing. Make kids go walk outside and go chase imaginary creatures, merging some of this where we can get some of our technology to force kids to get away from just sitting at the computer. But also, I think we can use technology for parents to help them do things like identify areas where they do feel this safety factor, where they're unsafe. And I think that's what you were alluding to earlier. Because as a mom and you're walking down the street and you're like, oh, this isn't safe, this doesn't feel good, you're not going to let your kid go outside, and you're not going to have this go out and go have fun and explore the world attitude to your kids. But if you had an ability to feel like you could say, like, this intersection is unsafe, and if I shared this with my commissioner or with my government leader, then they could do something about it that would make it safe, and my voice could be heard, and we could report that on my phone. I could just snap a picture of it on my phone and say, send here, boom, please fix this intersection, or please fix this defect in this sidewalk that my kid now can't ride their bike on, and utilize our technology for this instant reporting. We could improve the walkability of our neighborhoods. And I think that could be something that we can use in urban areas that could incentivize families to want to get out together. And anytime we can promote family togetherness, I'm a big fan of that as well.
I agree 100% with Dr. McKay is saying. I'll also speak to the power of the cell phone and Facebook groups. I'm sarcastically answering your question a little bit because Facebook groups are not a new technology and not exciting, but one of the best successes we've had in the Houston area are bike buses, where effectively a group of parents will say, all right, I'll take Monday, you take Tuesday, you take Wednesday, and all the kids are going to meet at this one area. One parent is just going to lead an entire group of bicycling 8-year-olds, and we're going to get to school. And two good things have happened where those interventions have been successful. It gets kids out and active. That's the name of the game. Two, it gives parents an opportunity to coordinate and get to know their neighborhood, our neighbors, which I think is a big part of why we're not doing this, that we don't really talk about enough. And three, it allows parents to see firsthand where the opportunities are for infrastructure developments in their own neighborhood. And then it makes them more civically engaged as well. So I didn't really answer your question.
But this is a vexing problem. It's easy for those of us who have more years to say, oh, I remember my youth and how great it was. And I appreciate very much the two of you being with us today and trying to figure out how do we give future generations the opportunity to get exercise, to get out, to walk and ride bikes. So thank you both for being with us today. Baker Briefing is brought to you by the Baker Institute for Public Policy, which provides meaningful, nonpartisan policy analysis on the most critical challenges facing Texas, the United States, and the world. Baker Briefing is produced by Victoria Jupp, Shannon Moriarty, and Karina Zimmel. AV production is led by Kevin Young. Our interns are Rice University students Riley Barker, Gray Beaubien, and Maria Marcus. Be sure to visit us at bakerinstitute.org to learn more.